There can be a lot to consider when making decisions about your health care, and lots of different ways to get information. Luckily, there is a way to learn about your HIV status from the comfort of your home. So, what do you need to know about HIV self-test kits? Let's talk a little bit about HIV. There's been a lot of progress in the United States when it comes to HIV. Through education, testing, and new medications, the prevention and treatment of HIV has led to an overall decline in new diagnoses. Annual infections in the U.S. have decreased by two-thirds since the height of the epidemic in the 1980s. However, not all groups are seeing that impact. Rates remain disproportionately high for communities based on race, ethnicity, and geographic location. In Indiana, Marion County is even considered a priority jurisdiction and was identified as one of 57 areas across the United States that is responsible for more than 50% of new HIV cases. Health inequities make ending the HIV epidemic challenging, especially when 1 in 5 people living with HIV in the United States are not aware of their status. Without this knowledge, these individuals are unable to make informed decisions about their own health care and can unknowingly transmit HIV to others. Someone living with HIV can spread the virus through sexual activity, needle sharing, or any other activity that exposes a person to blood, semen, vaginal fluids, rectal fluids, or breast milk. It could even take someone living with HIV 10 or more years to have noticeable symptoms. For all these reasons, the Centers for Disease Control and Prevention recommends that everyone between the ages of 13 and 64 get tested at least once in their lifetime. However, anyone getting tested or treated for an STI should be tested for HIV at that time. HIV testing should also take place at least once per year for those who have changed sexual partners, needle-sharing partners, and those living in areas with high rates of HIV. Based on Marion County's high priority status, the Michael and Susan Smith Emergency Department at Eskenazi Health recommends yearly testing for all individuals between the ages of 13 and 64. Accessing high-quality, preventive health care can be challenging. Limitations on time, money, and transportation may stop someone from getting the care they need to stay healthy. HIV self-test kits are an option that allow you to know your HIV status from the comfort and privacy of your own home, with no appointment unless you need additional care. HIV self-test kits are a great resource, whether you need routine screening or are worried that you may have been exposed to HIV. So, how do you use an HIV self-test kit, and where can you even find one? OraQuick self-test kits are FDA approved and, unlike other options, will provide a result without requiring the user to send a sample to a lab. This test uses a simple mouth swab that is rubbed from one side of your upper gums to the other, and then repeated along the lower gums. Then, the swab is placed in a liquid solution. The test cannot be in the solution less than 20 minutes or more than 40 minutes, or the results may not be accurate. Before using the self-test stick, avoid eating, drinking, brushing your teeth, or using mouthwash for at least 30 minutes. Reading the results is very similar to other self-tests that are taken outside of a provider's care, like a COVID or pregnancy test. There is a window on the test stick. A C for control and a T for test are next to the window. There is a triangle pointing to the C and a triangle pointing to the T. One line on the test stick next to the C triangle means that the test is working and the result is negative, meaning HIV antibodies were not detected. If two lines appear on the test stick, one by the C triangle and another by the T triangle, this means the test is working and the result is positive, meaning HIV antibodies were detected. If no lines appear, if there is a line outside of the C triangle, or a single line by the T triangle, This means that the test is not working correctly and there is no result. If two lines appear, no matter how faint the lines may be, it is important to follow up with a healthcare professional who can do additional testing to confirm the result. This second round of testing is necessary to confirm an HIV diagnosis and connect to care. The self-test alone cannot diagnose an HIV infection. It's important to remember that it can take up to 3 months for HIV to be detectable after coming into contact with a fluid that can transmit HIV. In other words, if someone thinks they may have been exposed over the weekend, a test that Monday may not be accurate. Anyone with a negative or a quick test is encouraged to test again within 3 months after the exposure for the most accurate result. HIV self-test kits are available through the OraQuick website and at most pharmacies. State and local health departments may offer programs to provide self-test kits for free or at a reduced cost. No matter where you get one, make sure to avoid storing your test in places that will get too hot, like a car or a mailbox. Results may not be reliable if the kit is kept in temperatures below 36 degrees Fahrenheit or warmer than 80 degrees Fahrenheit. HIV self-test kits allow you to know your HIV status and take decisions about your health into your own hands, literally. Visit oraquick.com to learn more about HIV self-test kits. If you want to discuss an HIV result or prefer to visit an Eskenazi Health provider, you can make an appointment by calling Connections at 317-880-7666.